is April 7th, World Health Day. And the theme for this year's World Health Day is Health for All. Now, one of the faces of India's healthcare response to the COVID pandemic was Dr. Randeep Guleria. With the recent rise in influenza cases, we spoke with him about viruses and how to protect ourselves from them. So to begin with, I would like to ask you, why is it important to understand the evolution of viruses and how does it impact each one of us, all human beings?
So I think it's important to understand that viruses have been there even before humans were here on this planet. And they are something between the living and the non-living, and they keep evolving. And I personally feel that because of a number of factors that have happened in this century, the last 23 years, we are seeing more and more outbreaks of viral infection in humans. And therefore, it's important to understand how viruses evolve, to be ahead of the curve, to be able to develop treatment strategies, vaccines, and management strategies in terms of surveillance for viral infections which are already circulating and which may emerge in the next few years or decades.
So like you said, viruses which are there, right? Can you tell us a little bit about H3N2, the virus which is on right now? How different is it from COVID-19 and how should people be prepared for it?
So H3N2 is an influenza virus.
Okay.
It's a different family. COVID belongs to the coronavirus. And influenza viruses are of A, B and C subtypes. A and B are the ones which affect humans and animals and even birds.
Okay.
So H3N2 has been there for quite some time. We've had cases of H3N2 in the past also. Currently what has happened is that H3N2 has become the dominant influenza strain causing cases of influenza. If you look back, in 2009, we had another pandemic which was H1N1.
Yes, H1N1.
Which was known as swine flu, which was also influenza A virus, which came because of what we called a genetic reassortment and an antigenic shift. Now, antigenic shift means that a new virus emerges, and that has a pandemic potential if two things happen.
Okay.
One is if this virus is new and mankind is not at all exposed to this virus, so we have no immunity.
Yeah.
Same is true for the COVID-19. Yeah. It was a new virus to which we had no immunity. And second is the virus has to have the ability of good human-to-human spread, sustained human-to-human spread.
Okay.
But other viruses become pandemic if they are novel and they have this ability for human-to-human spread. H3N2 on the other hand is not novel. It has the ability for human-to-human
spread. So we've built an immunity.
So we have an immunity, and what happens is, like I said, we have an antigenic shift. We also have what we call an antigenic drift. The virus mutates slightly.
Yeah.
And because it mutates slightly, it causes a little bit more infection. But our immune system still recognizes this as a part of the old virus and is able to build a response. So we don't get that severe cases in terms of severe hospitalizations, large number of hospitalizations, severe ICU admissions and deaths.
If you can tell us, what role does hygiene play in, when we are fighting against a virus or keeping ourselves healthy?
Hygiene plays a very important role because the infection spreads through various routes. One is, like I said, a droplet infection or an airborne infection which is there in the air. The other is if you touch a surface, it could be a door handle, it could be a top of a table. So washing your hands, maintaining a good hygiene is very, very important. And therefore, if you're traveling and you've come home, better to wash your hands immediately. Carry a hand sanitizer so that you can clean your hands on a regular basis, because that will also help in breaking the chain of transmission and preventing the transmission of infection.
So everybody needs to be more aware, of course, like you rightly said, about building your own immunity. So the last question on why is it important, when we talk about Lakshya, Sampoorn Swasthya Ka, health for all, why is it important for India as a nation?
So I think one of the important things that we realized during the pandemic is that if you have a healthy nation, your economic growth, your growth in all sectors will be much faster and better. And if health becomes an issue, then as we saw in the pandemic, all sectors get affected. And therefore, having a healthy nation is something which means that the nation has better productivity, is able to perform better, and overall quality of life becomes much better. Therefore, I think it's very, very important that we work on a strategy where we look at preventive health rather than curative health.
Yeah.
How can we prevent a large number of diseases, both infectious diseases and even non-communicable diseases? That will make it a healthy nation and our cost on healthcare will also come down.
Thank you so much, Dr. Guleria, for joining us and sharing your expertise as always. Thank you so much.
Thank you.